Hi, I'm Gary. I'm the CEO of 9 Health Fair. It's our 40th anniversary and I'm all by myself. All by myself. Did you know that half the people that come to a health fair have something they find they didn't know about? Did you know that half the people that come to a health fair don't find anything wrong with them? Do you know how good that feels? We have free screenings, we have low cost blood screenings, and we have community. These fairs are run by your neighbors for you, and it's for everybody. Go to 9healthfair.org to register online. How could you miss this party? I'm gonna be there, it's gonna be really fun.
It's a new day at St. Vincent General Hospital. We are getting ready to build a new facility. There are some limitations with this old building. It's from the late 1950s, so it's not a modern hospital. This new modern hospital will allow us to provide the level of care that is needed in this community.
St. Vincent Hospital's importance in the community is really about saving lives. We have our emergency room. We can react to those types of trauma situations that happen when you're 45 miles away from any other hospital. But then after you save a life, or after the life is saved, it's about how do we take care of this community ongoing?
I call it a micro hospital. It's 8 beds of inpatient care, 8 beds of ER. We'll also have 1 operating room. We'll have a GI suite, possibly pain management, full service lab, radiology, pharmacy, etc.
A lot of people want to come here for the lifestyle and they want to live here and feel like they are taken care of. And this hospital is an important part of that.
That first year, 55,000 people came to the first few health fairs. Several years later, the organization was so successful it was spun off into a nonprofit. When we fast forward to 2020, a rather strange year it's been. And the irony for at least our little organization is that prevention is at the root of helping this pandemic go away, really.
Prevention has really become another casualty of the pandemic, where a lot of us have put off our preventive visits, we've put off our wellness, and that's where 9 Health really comes in. They can really help you take back control of your prevention so that you can continue to make it a priority. 9 Health has changed, over the last 6 months, changed its entire operation to be able to provide screening in a number of new ways. We can do that at Quest Service Centers. Quest Labs is our partner for the past 41 years. We can do it through the mail. We're even running a few health fairs to get folks back out and get tested.
Having great, awesome people like this come through just to help us and guide us and put us on the right track is really great.
We are at Metro Caring and we are working with 9 Health to help people know if they are diabetic and how to take care of their health.
We're doing the preliminary screening to get people in here to see what their baseline is as far as BMI, blood pressure, height, weight, and getting their baseline hemoglobin A1C.
I got information about my A1C, which was not too good, but I also received resources.
Yo, let's take a trip down memory lane to recognize the school that left me better than I came. Now professionalism is steady flowing through the veins and infected with wisdom to analyze gram stains. At the University of Colorado, leadership in pharmacy has always been the motto. Faculty members have set examples we can follow. Fight out the Chi Sigma brothers yelling bravo. Now looking back the first year, I get a real sense of what I learned here. Communication skills, how to make the pills, and a genuine devotion to reshape the field.
So unique to have a daughterhood, her mother, in the same profession, in the same field. First semester I took 2 classes and I dropped one because the stress of traveling and doing my job and being in school, I didn't think I could do a good job. She said, "Mom, don't worry about it, you can do this." This was the best way I could do it. Really was right up my alley in terms of my interest and my current work situation. And it has been the best experience of my life.
So we use a pH meter and put sodium bicarbonate solution in that and add measured amounts of acid, a standard acid solution. And by those changes in pH, it will tell us how much of the sodium bicarbonate is in their preparation.
I have a really great opportunity to make a difference in a patient's life. And, the science is always changing. We get more new drugs approved than a lot of the other disease states that you could be managing. So you're never going to be bored. It's always really exciting. Every day is different, so I'm not going to see the same 5 patients every day. And I get to be challenged by questions they ask me or new therapies that come out.
Essentially what they do is 3 things. So they provide education to the patient. So I'm going to start them on a new treatment, and then it's the pharmacist who's going to go in there and explain, these are all of the side effects, this is how often you take the tablets, this is the dose that you're going to take, don't take it with food, do take it with food. The second thing they do is they definitely educate all of us about interactions. As we get patients who are living longer and are on multiple medications, the danger for interactions goes up. And then the third thing is access to drugs. So more and more I prescribe a drug, and all these hurdles have to be cleared in terms of what their insurance needs to do, whether it needs pre-authorizations, and having somebody who makes that their responsibility is just incredible.
As the Attorney General of Colorado, I am so grateful for the support of the School of Pharmacy and the work of the consortium and Dr. Rob Valek in dealing with opioid and prescription drug issues in the state of Colorado.
My name is David Goudulet, and I'm a clinical pharmacist with Valley-Wide Health Systems here in La Junta, Colorado. I think the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences did a wonderful job preparing me to practice in a rural setting, and I also think they do a wonderful job preparing current 4th-year pharmacy students to practice in a rural setting as well.
Than count by 5s, always taking time, saving patient lives. Looking over DDIs and the pro drugs that need to hydrolyze. To get to the active form. We are the Skaggs School of Pharmacy in the Mile High City where it's hard to breathe. Whether asthma, infection, or heart disease, we stay monitoring meds in a chart with ease. Don't forget the creatinine clearance. Call on all the patients to verify their adherence. Giving education so that they can understand that they're taking Synthroid for the thyroid gland. And with so many doses, always gotta remain focused. Learning pharmacotherapy from respected professors, authors to guidelines every semester. They helped me become an independent practitioner when pharmacy training required analyzing literature and working with the team to improve patient outcomes. All my appies couldn't have done it without them. And I sit here grateful for every teacher that was willing to provide me guidance, education till I got a brain full, can't contain appreciativeness inside me. And let's not forget my peers who throughout the years gave me lots of cheer. I am ready for my career and to practice at the pharmacy frontier.